Next topic is gas exchange. The gases that we're interested in here in our respiratory system are oxygen and carbon dioxide, so O2 and CO2. And there are two areas of interest where oxygen and carbon dioxide will diffuse or travel between, and those are in the lungs, where oxygen travels between the alveoli to the pulmonary capillaries, and carbon dioxide goes from the pulmonary capillaries into the alveoli, and the tissues. So oxygen travels from the systemic capillaries into the muscle fibers, and vice versa. Carbon dioxide goes from the muscle fibers into the systemic capillaries. Now, gas moves via just simple passive diffusion, so it doesn't need active transport. It doesn't need a transporter that picks up oxygen and carbon dioxide and moves them across those membranes between the alveoli and the capillaries, for example. So just simple passive diffusion, and it needs a driving pressure. So the gases don't just move by themselves in a random fashion. They go down a gradient. The driving pressure here is a pressure gradient. It could also be a concentration gradient, but in terms of gases, we're looking at pressure differences. So partial pressure of oxygen and partial pressure of carbon dioxide. And if there's a higher pressure of oxygen in one area of a membrane or of a barrier, then it will move towards the area of lower pressure. We're going to start up in the lungs. We have a capillary here, and then dumping into the pulmonary veins. And then we're going to have a heart. So we're going from the pulmonary vein into the heart, right? And we're always looking at left side and right side. So our pulmonary vein dumps blood into the left side of the heart, left atrium and left ventricle, and pumps it out through the aorta down to the into the body's tissues. And I'm going to draw this aorta right here. It has a little arch, and then down to, I'm going to draw now a muscle fiber. Something like this. We're going to have striated muscle fiber down here. And then, so we have the systemic capillaries to the muscle, and oxygen is traveling between those systemic capillaries into the muscle fiber and into the mitochondria, where it's then being used as energy, or to make energy, to make ATP, so that our muscle can work. Carbon dioxide that is produced in the muscle during that metabolism step is then going from the muscle fiber back into the systemic capillaries, and that blood is moving to the right side of the heart. Right atrium, right ventricle, and is then being pumped out. And we have a circle. We have the pulmonary artery on this side. So here we have the aorta, and blood traveling from the lower body's tissues to the heart. We have the inferior vena cava. And if it's coming from anything above the level of the heart, then it's the superior vena cava. And we have here lungs, and this is muscle. So now the first area of interest that we're going to take a look at is in the lungs. So the area up here, we're going to look at gas exchange between the lungs, more specifically the alveoli and the pulmonary capillaries. All right, so we're zooming in, and we have now an alveolus right here. And we have gas exchange, air coming in and out of the alveolus. And I'm going to draw a pulmonary capillary in here. We have blood flow coming in and going out of this pulmonary capillary. We have some red blood cells in here. So those are red blood cells. And we have pulmonary capillary coming in and out. The blood that is returning from the body comes in through the pulmonary capillaries and is rich of carbon dioxide. And carbon dioxide wants to diffuse into the alveoli. So from a high pressure to a low pressure area. On the other hand, we have a high pressure in the alveoli. So oxygen wants to diffuse from that high pressure into the lower pressure that is in the pulmonary capillaries. So we have gas exchange here, and let's take a look at the pressures. Let's put some numbers to this. So in the alveolus, the pressure of oxygen, the PO2, is around 100 millimeters of mercury. The PCO2 is around 40 millimeters of mercury. The blood coming in the pulmonary capillaries, we have a high partial pressure of carbon dioxide, and it's about 45 millimeters of mercury. So 45 wants to go down to lower pressure, 45 to 40. That's why carbon dioxide diffuses from the pulmonary capillary into the alveoli. The partial pressure of oxygen is only about 40 millimeters of mercury. So that's why we have a lower pressure of oxygen in the capillary, lower than what is in the alveolus of 100 millimeters of mercury. So we have oxygen diffusing from the alveoli into the bloodstream. And ideally, we have complete calibration between those two areas in the alveoli and the bloodstream. So what is coming out after the blood has gone past the alveolus is an oxygen pressure here of 100 millimeters of mercury, exactly what was in the alveolus, and a partial pressure of carbon dioxide that is 40 millimeters of mercury. So ideally we have complete calibration so that the blood is picking up as much oxygen as it can and gives off as much carbon dioxide as it can. Now we're going to take a look at the other area of interest, and that is down between the systemic capillaries and the muscle fiber. Okay, in the systemic capillaries and the muscle fibers, gas transport, gas exchange. So I'm going to draw one big muscle right here. This is my muscle fiber. And put some striations in here. And a few mitochondria. Why not? Mitochondria all over here. That's my muscle. And then I have blood supply. right here. Let's say this is a systemic capillary, and blood is coming in here and going out here. And again, we have our red blood cells in here. Okay. So in this case, we're producing carbon dioxide, CO2 is produced and wants to go out of the muscle and into the systemic capillary. Oxygen, on the other hand, is being delivered by the blood and is being used by the muscle. So we have gas exchange, oxygen exchange coming in from the capillaries into the muscle fiber. Let's look at the driving forces, the pressures within the muscle and the systemic capillaries. In the muscle, let's start in the muscle, we have a PO2 of about 40 millimeters of mercury. This is at rest, in resting conditions, and a PCO2 of about 46 millimeters of mercury. Now, in the systemic capillaries, the blood is coming in, the PO2 is around 100 millimeters of mercury. Right? That was the pressure that was coming in, that was in the pulmonary capillaries, and then it travels to the heart and down into the systemic tissue, the systemic side of things. So in the capillaries, we have the same condition that we had up in the lungs, almost the same, I should say. PCO2 coming in was 40 millimeters of mercury. Okay, so look at the driving pressure for oxygen, going from 100 millimeters of mercury down to 40. So oxygen is traveling from the systemic capillaries into the muscle fiber. On the other hand, carbon dioxide, the pressure is higher in the muscle at 46 millimeters of mercury, versus in the bloodstream coming in, it was only 40. So carbon dioxide is moving out of the muscle. And then let's take a look at what's coming out of the systemic capillaries once we had complete calibration of those gases. So oxygen pressure that's coming out is the same as what it was in the muscle. So 40 millimeters of mercury, and PCO2 is coming out at 46 millimeters of mercury. And that blood is then going back to the heart and back to the lungs.